16th branch of MegaMart and MacroMart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. MegaMart and MacroMart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.
Good evening friends, welcome to a new episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. I am Anupama Menon. In this talk show Health World, we have expert doctors from various fields providing valuable information to assist you all on your journey towards good health. Good health begins with the mouth. Scientific studies have proven that poor oral health can lead to a lot of medical complications, which in turn may affect and compromise the quality of life and the general well-being of an individual. I'm sure many of our viewers have a lot of questions and doubts regarding maintaining good oral health and oral hygiene. To clarify these doubts, we have with us today Dr. Komal Sharma, specialist endodontist from Al Hilal Hospital, Moharrak. She comes with an experience of over 15 years in the field of dentistry. So let's now move over to her and know more about oral health and oral hygiene. Doctor, thank you for joining us today and welcome to the show.
Thank you.
So let's begin by clarifying the most common doubt that a lot of our viewers have. What is the right age to start visiting a dentist?
to begin with, I would say a lot of people have a notion that only after you get your permanent teeth coming out is the right time that you need to see your doctor, or they would even wait for any symptoms or pain to come about before they actually would plan a visit to the dentist. But that's really not true, because I would say as soon as a child who's probably even 5 or 6 years of age, or probably even younger, once he has all his milk teeth, giving a routine visit to a dentist is important. Or as soon as you see if there is any discoloration in the mouth, or if you feel the child's oral health is not in a good state, it is important to just give a routine visit to your dentist, because keeping your milk teeth in a good situation, in a good state, is as important as keeping your permanent teeth in good state. So I think it's not a very good idea to ignore your milk teeth.
So in your opinion, it's better to start early, maybe as early as 4 or 5 years?
I would say yes, or even earlier, because we have parents who bring kids of probably even 2 or 3 years of age, because you have most of your milk teeth out by that time. And it's important to keep them in good state, because as we will be discussing about it further, because the function of your milk teeth is not just to provide you with a masticatory function till you get permanent teeth, but also it maintains the space which later will be occupied by your permanent teeth. So I think it's important to keep them in a good state right from the beginning. So I think once all the milk teeth have erupted, it's important to give a visit to your dentist. It could be a routine dental visit. You do not need to wait for any pain or discomfort to occur.
Okay,
so I think the earlier the better.
Next question, because a lot of us, and not just in the case of kids, even with adults, we are always hesitant to visit the doctor unless we have some problem going on. We always wait for some pain or discomfort. So do you think a regular visit to the dentist, even when we don't experience any problem, can prevent
absolutely, I would say that, because it's not a good idea to actually wait till you start getting some pain or discomfort, because we do have a lot of cases coming to us. The time they arrive at a dental clinic, or the time they come to us, they probably would even have ended up in a bad tooth decay,
maybe an infection.
There is an infection, or they end up in a swelling right away, but they have never had any history of pain. So we do have cases like this.
And so then I guess the treatment also becomes more difficult.
Absolutely, absolutely. And in fact, the time they come to us, by that time it's almost the stage where we can barely do much about the tooth, and we probably, the only option left with us will be to remove the tooth. So I think do not wait for some signs or symptoms to come, and then probably, or just a lot of people, if they get some pain, they will just take in a painkiller and try to delay it as much as possible, which again is not a good idea. So I think just giving a routine dental visit, a routine checkup can actually prevent a lot of hassle later. So I think that should happen every 6 months, or even in some cases, a lot depends on your if you are at high caries risk, which can vary from individual to individual. So your dentist would advise you how soon you should see him again.
So in your opinion, at least once a year, a normal visit to the dentist to see everything is in order or not?
Yeah, so once a year, or 6 months to a year should be a good time.
Okay, even if we are not experiencing any problems as such.
Yeah.
And talking about cavities, doctor, in a lot of cases we have seen that even though proper oral hygiene is maintained, brushing twice a day and regular brushing and all that, still people tend to get cavities. So what could be the reason behind this?
To this I would add that people have a notion that if we are brushing twice, I think we are doing our job and everything is taken care of. But most of the problems arise by our in between eating, because throughout the day there is a lot of sweet that goes into us, and basically it's that lingering sweet which is the cause of cavities that happens. So, I think even as adults, we are in a habit of snacking, we are in a habit of taking not just sweets, but you know, it could
keep
be
munching
beverages.
on something throughout
Yes,
the day.
or even beverages, because I
okay.
think that is more harmful than actually food that we are munching.
Oh, is it? You mean the
Yes.
carbonated drinks?
It could be
fruit
that, it
juices
could be
and
your
all that?
tea, it could be
Coffee, anything. Okay.
even if you don't have sugar added to it, even then, you know, because that we are not in a habit of rinsing our mouth after that, most of us.
Okay.
You know, so we don't even keep track of how many times we are, you know, actually taking sugar or sweetened drinks, or even munching onto the stuff which is in between your main meals, and that is a bigger culprit than the sweet that you are actually taking with your meals. So, it is important. I would suggest one key thing that you can do is, after everything that you eat, or even when you sip onto something, just rinse with plain water. I think that would at least solve a lot of your problem, that this is besides your routine brushing. So, it is very important to just do a simple rinsing with water. It can be with a mouthwash, it can be with just plain water, but after everything that you eat or drink, just rinse. So, I think that will play a very important role in preventing your teeth from cavities.
Okay, so rinsing the mouth after everything that you have,
or
you know,
drink.
throughout the day.
Yeah.
Besides brushing twice a day, this is also
Absolutely.
equally important to prevent
Absolutely.
bacteria build up and further
true,
decay.
true.
That viewers, so please note this point. I think this is one thing that we all tend to neglect. We do brush our teeth twice a day regularly, but throughout the day, whatever you munch on, even if you drink tea or coffee, please do make it a point to at least rinse your mouth so that you can keep it healthy. So coming to the next point, doctor, there's a lot of misconception about tooth cleaning, that whole process, you know, because it does lead to little bit of bleeding when it's done, and a lot of us feel that this actually leads to weakening of the teeth. Is there any truth to it?
To this, you know, on the contrary, I would like to add that the reason why getting your tooth professionally cleaned at regular intervals is advocated, because in case you are not doing it, there is, you know, the plaque deposit which happens in your mouth can in turn lead to weakening of your gums and your teeth. Okay. So, yes, when you get your cleaning done, there can be scenarios where you can experience some bleeding for your gums.
Even
initially.
sensitivity
Absolutely,
at times.
absolutely. There can be sensitivity, and there is a reason behind it, because, you know, initially your teeth might be covered with a layer of plaque, which most of us don't realize. So, once that is removed, it will take some time before your gums get back to the normal shape, or occupy the space which was actually occupied by plaque. You know, so certain things you might experience after cleaning, which probably your dentist will be advising you upon, and with that, generally certain you know, gels or some solution will be given to you post your professional cleaning, which will take care of this bleeding and sensitivity. So, it's a very transient period where you might experience this, but in the long run, surely it will do a lot of good to your teeth and gums.
It's extremely important to get professional cleaning of the teeth.
But then
done.
again, I would like to add that you know, it's very important to take an opinion from your dentist, that whether at what periods of time a professional cleaning is required. What kind of cleaning, whether you need a superficial cleaning or you need a deep cleaning. So, it might vary. It might vary depending on the condition of your you know, teeth and your gums. So, I think it is important to take an opinion and then follow as advised.
Okay. And sometimes, you know, when a dental procedure needs to be done, we have come across cases where dentists ask for our medical records, you know, especially when it's heart patient, you know, they ask for a certificate from the cardiologist approving that it's okay for the patient to undergo this procedure. So, do you normally ask for medical records from all the patients, or do you have any criteria in mind when
you know, I would want to add this thing before I come on to answering this question, which is that, you know, there is a saying that your oral cavity or your mouth is a mirror to your body.
True.
Because I would want to say that there are a lot of systemic diseases wherein the first symptoms that appear, they appear in your mouth, in your oral cavity. In fact, a lot of medical conditions are diagnosed looking at your oral cavity and the condition of your teeth and gums. So, I would say that both your oral conditions treatment and your medical health issues kind of are dependent on each. Yes, they are interlinked. And the reason, because there are a lot of procedures which are dependent on the parameters, basic parameters of your body, which is because there are certain questions we ask all the patients, which is your blood sugar levels, your blood pressure, are you on any medications, because that might interfere with the medication that we are going to give you, or any blood dyscrasias, your basic hemoglobin levels, or any other any vitamin deficiencies. So, lot of these things, a lot of the medication that we give might interfere with the medication that you are taking. Certain things get contraindicated if you are already on some medications. Certain procedures have to be modified depending on what your parameters are, or the kind of things, the kind of medication that we use during the treatment need to be modified. So, that is a reason why it is important, like we take special precautions in cases where the patient is heavily medically compromised. And then as a protocol, we have to perform the condition only after we take a clearance from their treating doctors or the medical specialists. So, surely it is an important question which should be asked, and certain basic questions are asked from all the patients, but in certain cases we would need some medical records, or we need to liaise with his treating doctors.
And is it only for people above a certain age, elderly patients, or you do this with all kinds, all age groups?
Certain basic questions are asked from all the patients, irrespective of the age. Even if it is a child patient, we would want to know if there are any blood dyscrasias, any underlying
medication that they are on,
any genetic or any congenital problems. Certain kids have issues by birth. So, it could be patients of any age.
Okay. So, it is very important that the dentist knows the complete medical history of the patient being treated.
Absolutely.
Okay.
The 16th branch of MegaMart and MacroMart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. MegaMart and MacroMart, your favorite shopping destination.
So, doctor, what are the options available for tooth replacement? Because this is one issue that a lot of people may face, especially in the case of kids also. They may lose a tooth because of a fall or an injury, or even because of tooth decay in the case of adults. So, are there enough options available for tooth replacement?
I would say in today's scenario, the first preference by any dentist is to conserve your natural tooth as much as possible. But then there are situations where it's to keeping the tooth in your mouth can actually degrade the condition of the tooth further, or it might even affect the nearby teeth. So, the last option remaining with us would be to pull out the tooth. So once that happens, certainly we have options available. Now those options depend a lot on the present condition of the bone which is remaining in that area, the age of the patient, the medical condition of the patient. So, our options would depend on a lot of factors. Generally speaking, the options that are available in case you want to give an interim prosthesis, which is like you want to give a temporary prosthesis till you actually decide upon to giving a permanent prosthesis there or a permanent replacement there. So in temporary we have a removable denture. Okay. Now this can be given in cases, like in case of kids, if they end up losing a tooth. So in that case, we try to delay the permanent replacement till all their permanent teeth have erupted, because the prosthesis can interfere with the occlusion happening. Or at times we need to, even in case of adults, we need to wait till the bone healing happens, till we give a permanent replacement. So in that case, the temporary prosthesis is given. Also in cases where some of the adult patients or some of the old patients where the bone condition is not very good, it will not be able to take the load of the permanent prosthesis, or in some cases we take, in case of permanent replacements, we take support from the nearby teeth. If the condition of those teeth are not very good, then the only option we are left with is to give a removable denture. So that option is there with us. Then we have another option, which is giving a bridge. Now in that case, we are taking support from the front and the back teeth, and it's a cap which is placed on the front and the back teeth, and with using that support we place a tooth in the missing area. Another thing which is quite commonly quizzed about, and we have a lot of patients coming to asking about, is about implants. Now in implants, basically we are not taking any support from the front and the back teeth. We are just placing something called as a screw which is in the bone, and using that screw as a support we place the tooth in the missing area. Okay. So now they are, as I mentioned before, that all these options depend on a lot of factors. So you will have your dentist examining you. He might be referring you to a specialist who might be examining the condition of your bone, or what are the options which are suitable for you. But surely we do have options. Even in the worst case scenario, some other option is available to replace your teeth, and it is highly recommended that once you lose a tooth, you should surely replace it, because in case you don't do it, your other teeth start getting affected. They might start moving into that empty space, and basically they end up losing the bone support when they move into that empty space. So it's not a very good idea to leave the space empty for a very long time. Okay. So you can just visit your dentist and probably take an overview of the options which are available for replacement.
Okay, so it's reassuring to know that at least it can be replaced, I guess, depending on the person's oral health, and like you said, you have to take a lot of factors into consideration. So either removable dentures, as you mentioned, or bridges, or even a permanent tooth implant. Good. And what about crowns and cappings? Because root canal has become very common these days. But in a few cases, what we have seen is after the root canal procedure is done, a lot of patients do not even come back for the capping or crown, thinking that the problem has been taken care of, But do you think to leave that tooth which has been treated with root canal without a crown, will it lead to any other complications in the future?
Now what happens is that generally I think it's almost an everyday scenario where people complain that I did a root canal and I still lost my tooth. So that did not happen because of the root canal. Okay, that happened because probably after the root canal, now the reason why a root canal basically is done, because you have a tooth decay, and that decay is quite big, which has actually touched your nerve. So when there is a tooth decay, it's quite understood that you are losing a lot of good tooth structure. So your tooth is already weak.
Yes.
Now next comes when we do the procedure of a root canal, as most of you would understand, you have to be actually, going deep into your tooth. You need to be removing the decay, you need to be preparing the tooth for a filling. So that procedure by itself might, it becomes mandatory to remove a part of the tooth further. Without that, because without doing that, we can't really complete the procedure. So after this happens, we do give a permanent filling, but another thing I would also want to add is that, in a layman's term, I would say that, the tooth does not have any blood supply to it, which would again weaken the tooth further. So what do we do after we complete the treatment? We cover it up, but it's important to cap the tooth. So basically it is adding, it's like, adding structure to your tooth so that it becomes functional again, so that once you start putting the load, we have this structure on it to support the load which is falling onto it. Because if you don't do that, and if you have some excess load, or you suddenly end up biting something hard on that area, so it's quite obvious the tooth will end up in a fracture, and then the only option left is to just pull out the tooth. Okay. So sometimes, yes, we do come across teeth which are fractured, where we can do a process and we can still build up the tooth structure and put a crown. But in most of the cases, the way the tooth would fracture, the only option left with us will be to pull out the tooth.
Pull it out. So crown actually offers a very good layer of protection for the tooth, yes, which has been treated.
Yes.
To make, yes, sure that it can take the load when we are chewing something. Otherwise, absolutely, it tends to become brittle, absolutely, even after the root canal.
Yeah.
Okay. So when is the right age to start the braces, the treatment that we do for misaligned teeth? So should we wait for the kids to develop their permanent set of teeth, or can this treatment be started even before that?
I would say that generally when the patient is in a mixed dentition stage. Now when we say a mixed dentition, it is when your permanent teeth are in the stage of erupting. I would say more than 50% of your permanent teeth have erupted. So that is the time when the maximum growth of your bones is happening. So although it might vary from case to case, but it's very important. Again, I would highly recommend that you need to visit a braces specialist, which is actually an orthodontist, because every case might differ. The duration of the treatment, the point where the treatment needs to be started might vary. So I would say that do not wait for you to see any misalignment. So, much before you start noticing any misalignment, I would say there is absolutely no harm in just giving a casual visit to your dentist. And if they feel that the child might need braces in future, maybe even if not now, I would, he would at least give you an idea about what will be the right age where you need to see an orthodontist, or probably you can see the orthodontist now. And sometimes, there are certain teeth which he might be starting the braces treatment later, but there might be some teeth where he would say that yes, we might need to retain these teeth, and we might need to remove some teeth to create that space. So that all these procedures, it's very important for the the patient to just give a casual visit and at least get an idea whether he might be needing the treatment or no. Because sometimes what happens that the patient might approach the dentist at a very late stage, where when we plan to start the treatment, it might not give a very good result. So I would again recommend that don't wait for for you to notice any crowding or malalignment. Because it's not just about the crowding or your appearance, because what happens when your teeth are not positioned properly, it would in turn lead to food getting stuck on those spaces in the crowded areas, which again would lead to plaque accumulation. It can lead to cavities. It can again lead to your teeth and the gums becoming weakened.
So it's not just cosmetic, it can also lead to other issues.
Yes. So the caries which are developing can affect your permanent
teeth as well.
So it's not just about the milk teeth or your appearance. One thing can lead to another. So it's important to visit your dentist at the right age, probably as soon as you see the permanent teeth coming out, or you have at least 25% of your permanent teeth coming out. So I would say the key is to just give a visit to your dentist and just take an opinion.
And what about tooth sensitivity? This is a common problem faced by a lot of people, having something hot or cold, extreme sensitivity to having very hot and cold things. So what could be the reason behind this?
I would say that I think almost everybody at some point in their life would experience tooth sensitivity. Now it could be due to some cavity in your teeth. Now why does the sensitivity really happen? Now it happens because your teeth is basically made of different layers. So when probably the most protective or the outermost layer starts eroding away or is missing, it could be due to cavities, it could be due to wearing off, and that is when the patients start feeling sensitivity. Okay. So it could be a lot of reasons. When I say about the cavities, yes, that could be one area where you can probably visit your dentist. It could be an indication that something is wrong. Okay. Another could be that if there is wearing away of the teeth, so either there is something wrong with your bite or probably your eating habits, because a lot of tooth wearing away happens because of fizzy drinks, as I think most of us have heard, or probably because of eating habits, the way you're biting. If there is an issue with your bite, that can cause wearing away of your teeth. Can we cut it here? Okay. So the decay can also happen because of the wearing away of the teeth. So I would say that the moment you start feeling sensitivity, it could be an indication that something could be wrong somewhere. Most of the times if a dentist might not find something grossly wrong, probably they might prescribe you with some gels or toothpaste which might take care of the sensitivity. But again, it's important to visit them to find out the root cause. What is it that is causing the sensitivity? So at least probably the cause could be caught at the right time. So now I think we have so many pastes and gels and mouthwash over the counter which are available for the sensitivity, which are easily accessible. So it is a good idea to start using that, but at the same time I would emphasize, do visit your dentist, because that is only the symptom, but there has to be a root cause. In most of the cases there is a root cause.
Okay.
So once the symptoms subside, we never bother to actually visit a dentist, we never think of the root cause. So I think that should be stressed upon. Okay. So you can start using probably what is available to you over the counter, but at the same time do spare out some time and do give a visit to your dentist to find out if maybe there is something else.
So it's not something to be taken very lightly, because there could be some underlying cause.
Yes. Yes.
So it's better to definitely visit a dentist and find out what exactly is wrong.
True.
So doctor, before we wrap up, any takeaway message that you would like to give our viewers on how to maintain good oral health and oral hygiene?
Okay. I would just put it simply as that things generally people consider a visit to the dentist as they generally relate it to a lot of pain. They relate it to something that can be very complicated. But I would say that just if you visit your dentist at an early age, it can actually spare a lot of agony in future. Things can be simplified a lot more than probably if you see them at a stage where things or even the treatment procedure can actually get very complicated, because probably you have reached at a level where treatment certain damages could be irreparable. So I would just say that just giving a regular dental visit can probably simplify things a lot and can make life easier for you rather than putting you through some agony. And I would also like to add that with the technologies that we have now, most of the treatments are pain free, most of the treatments are less time consuming. So I think there is the only thing that you need to do is just spare out some time and give a visit, and maybe things are not as scary and complicated as what most of us might think they are. So I think all I would want to say that just take out some time for yourself and probably love your body and it will love you back. So that's all I would want to say.
Definitely. And I'm sure those words are very comforting for our viewers, to know that with latest advanced technology, it's not as painful as it used to be earlier. So regular visits to the dentist are very, very important. So thank you so much, doctor, for taking the time out to be with us today and for clarifying all the doubts in detail. Thank you so much. Appreciate your time.
All right.
Thank you. So friends, I hope all of you found this episode very informative. Keep flaunting your pearly whites. A smile is the most inexpensive and the best accessory that you can wear. Do pay regular visits to the dentist. Take care of your oral hygiene. Stay healthy and happy always. Till we meet again next time, this is Anupama signing off. Good night and stay happy.
The 16th branch of MegaMart and MacroMart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. MegaMart and MacroMart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmedia